Hey everyone, welcome back to Sexual Health USA. Today we're diving into an incredibly important topic, STIs, or sexually transmitted infections. Whether you're sexually active or just curious, understanding STIs is vital for your health and well-being. So let's get started. First, let's define what STIs are. STIs are infections that are transmitted through sexual contact. They can be caused by bacteria, viruses, or parasites. Some common STIs include chlamydia, gonorrhea, syphilis, HIV, and herpes. It's essential to know that anyone who is sexually active can get an STI, regardless of age, gender, or sexual orientation. So how are these infections transmitted? STIs can spread through various forms of sexual contact, including vaginal, anal, and oral sex. Some infections can also be transmitted through skin-to-skin contact. It's important to remember that not all STIs show symptoms, so you might be at risk without even knowing it. Now, let's talk about symptoms. Many STIs can be asymptomatic, meaning you might not experience any noticeable signs. However, here are some common symptoms to watch out for. Unusual discharge, pain during sex or urination, itching or irritation in the genital area, fever or swollen lymph nodes. If you notice any of these symptoms, it's crucial to get tested. Getting tested is essential for sexual health. Most healthcare providers recommend that sexually active individuals get tested at least once a year, or more often if you have new or multiple partners. Testing is usually simple and can involve a urine test, blood test, or a physical exam. Remember, early detection can help prevent complications and spread. Now let's talk about prevention. Here are some effective strategies to reduce your risk of STIs. Use condoms. Condoms are highly effective in preventing many STIs. Limit number of partners. Having fewer sexual partners can lower your risk. Get vaccinated. Vaccines are available for some STIs like HPV and hepatitis B. Communicate. Talk openly with your partners about sexual history and testing. Remember, it's all about making informed choices. If you do test positive for an STI, don't panic. Many STIs are treatable with antibiotics or antiviral medications. Here's a quick rundown. Bacterial STIs, usually treatable with antibiotics. Viral STIs, while they can't be cured, symptoms can be managed with medication. Always follow your healthcare provider's recommendations for treatment and inform your partners so they can get tested as well. Let's take a moment to address some common myths about STIs. Myth 1. Only promiscuous people get STIs. Fact: anyone can contract an STI, regardless of their sexual history. Myth 2. You can tell if someone has an STI just by looking at them. Fact: many STIs are asymptomatic. Myth 3. You can't get an STI from oral sex. Fact: STIs can be transmitted through oral sex too. To wrap up, understanding STIs is essential for maintaining sexual health. Remember to communicate openly, get tested regularly, and practice safe sex. If you have any questions or experiences to share, drop them in the comments below. Don't forget to like, subscribe, and hit that notification bell for more informative content. Stay safe, and see you next time. First off, let's break down what STIs actually are. STIs are infections that can be transmitted through sexual contact, and they can be caused by bacteria, viruses, or parasites. Some common STIs include chlamydia, often asymptomatic, but can cause serious reproductive issues if left untreated. Gonorrhea, similar to chlamydia, it can also affect various body parts and lead to complications. Syphilis has several stages and can lead to severe health problems if untreated. HIV, a viral infection that attacks the immune system. If untreated, it can lead to AIDS. Herpes, a viral infection that causes sores and can remain dormant for long periods. Understanding these terms is crucial, as early detection can lead to effective treatment and better health outcomes. So how exactly are these infections transmitted? STIs can spread through various forms of sexual activity, including vaginal, anal, and oral sex. It's important to note that some STIs can also be transmitted through skin-to-skin contact, even if no penetration occurs. In particular, infections like herpes and HPV can be passed along even when the infected person shows no symptoms. This is why understanding your partner's sexual health history is so important. Communication can significantly reduce risks and promote a healthier sexual experience for everyone involved. Next, let's talk about symptoms. The unfortunate reality is that many STIs are asymptomatic, meaning they can be present without causing any noticeable signs. However, Here are some common symptoms to watch out for. Unusual discharge. This could be from the vagina or penis and might have a different color or odor. Pain during sex. Discomfort or pain can indicate an underlying issue. Itching or irritation. This could be in the genital area or surrounding skin. Fever or swollen lymph nodes. These can be signs that the body is fighting an infection. If you notice any of these symptoms, it's crucial to seek medical advice. Remember, even if you feel fine, regular testing is key to staying healthy. Now let's talk about testing. Getting tested is essential for maintaining sexual health, and it's a responsible step for anyone who is sexually active. Most healthcare providers recommend that sexually active individuals get tested at least once a year, or more frequently if you have new or multiple partners. Testing can involve a urine sample, a blood test, or a physical examination, depending on what STIs are being screened for. Many clinics offer confidential and sometimes free testing, so don't let cost deter you from getting tested. Early detection can lead to better outcomes and can help prevent the spread of infections. Use condoms. Condoms are one of the most effective ways to reduce the risk of many STIs, including HIV. Be sure to use them consistently and correctly. Limit number of partners. The more partners you have, the greater your risk. Consider your sexual network and choose to engage with fewer partners. Get vaccinated. Vaccines are available for some STIs, such as HPV and hepatitis B. Speak with your healthcare provider about which vaccines are right for you. Communicate. Have open and honest conversations with your partners about sexual history and testing. Establishing trust can make these discussions easier. Regular testing. Make it a routine to get tested regularly. This not only protects you, but also protects your partners. If you test positive for an STI, it's essential not to panic. Many STIs are treatable with antibiotics or antiviral medications. Here's a quick breakdown. Bacterial STIs, infections like chlamydia and gonorrhea, are usually treatable with antibiotics. If caught early, they often won't lead to serious health issues. Viral STIs, infections like herpes and HIV, can't be cured, but they can be managed with antiviral medications. These medications can help reduce symptoms and lower the risk of transmission. Always follow your healthcare provider's advice regarding treatment, and don't forget to inform your partners so they can get tested and treated as well. This way, you can work together to break the cycle of transmission. Let's take a moment to address some common myths surrounding STIs. Myth 1. Only promiscuous people get STIs. Fact: anyone who is sexually active can contract an STI, regardless of their relationship status. Myth 2. You can tell if someone has an STI just by looking at them. Fact: many STIs don't show visible symptoms, so the only way to know for sure is through testing. Myth 3. You can't get an STI from oral sex. Fact: STIs can definitely be transmitted through oral sex, so it's important to protect yourself. Debunking these myths is crucial for fostering a more informed and supportive community around sexual health. To wrap up, understanding STIs is essential for maintaining your sexual health and that of your partners. Remember, knowledge is power. Communicate openly, get tested regularly, and practice safe sex. If you have any questions, experiences, or tips to share, please drop them in the comments below. Your stories could help someone else. Don't forget to like, subscribe, and hit that notification bell for more informative content. Stay safe out there, and see you next time.